this computer. We're recording. Hey guys, this is Robin.
And this is Karla.
And we're here to bring you some information that is going to help you to use your Invisalign assets to come back after this COVID crisis and help manage your cases during the crisis. And
Yes.
we're going to show you our screen. Make this as fast and easy as possible. All right. Now here we are.
Awesome.
Karla, go ahead and tell us what the purpose of this is.
So a few weeks ago, you and I were on the phone and I was like, trying to figure out how to deal with specific situations. And then I was like, you know what, we should collaborate on a project and do this together. So I figured we could share everything that we're getting from Invisalign, all of the resources and assets, and how to put it together in our practices. So then this project was born. So basically, we're going to try to leverage everything that we have, all of the assets, all of the resources and everything, so that we can try to put together a plan so that our friends and our colleagues can share it with their team members and, know how to basically differentiate between each situation and how to manage the patients. So, yeah.
Love it. I really want to emphasize the importance that when we do come back and revamp up, we want to spend our time, seeing patients. So while the downtime, while we have downtime, we could be managing these Invisalign cases efficiently so that when we come back, we're productive.
Right. And you and I were both worried about, just coming back and seeing like a wave of like follow-ups and all of these patients and delivering aligners and things that we love seeing our patients, but still going to take time away from our chair, from being able to see some production. So we figured we could, try to do everything together and still manage our patients and connect with our patients without having to, spend some chair time, very valuable chair time. So we put together a list of assets and resources that Align is giving us right now.
Absolutely. Let's go through them. There's first the clinical resources that are helping us manage our cases. One that I think is really important is the Invisalign Hold program. We'll go into a little detail about that. Smile Consultation, which is actually driving patients to your practice if you've opted in, and patient virtual care, which we'll go into a little more detail later.
Right. Then also some of the business resources, what's Align doing basically for a bottom line, and how are they helping us in this difficult situation where we're having no cash flow. And I think, Robin, we can go over a little bit of detail on this because we're not going to really tackle this later on. We're going to focus on the clinical part.
Totally.
So the advantage tier status, I know most people have heard. We're going to be able to keep our status. It's not going to change. And not only that, but the rollover points that we got from, last year for the Don't Hold Back program. That's what it was called, right?
Yes.
You get to like roll them over to July 1st. So I thought that was great news because I doubt anybody can keep their status with that. And I think, you might want to take this next one, Robin, because this is a cool one to say.
Yeah, the fact that iTero subscription fees are completely waived. It's not postponed, it's waived for the month of April. And that's a big deal.
Not like, what some people are thinking. It's just completely a wash. That's huge, I think.
I think so too.
Yeah. I like this next one because I actually had ordered already replacement aligners for some of my patients, before this became official. So they're actually going to credit retroactively some of those replacement aligners that you ordered between those dates from March 26th to April 6th.
That's huge. Yeah.
And then the one-on-one is, whatever your situation is, we're told, just talk to your rep, talk one-on-one specifics, and how else they can help you in terms of your account and stuff. So that's more of a one-on-one situation. There's no blanket statement on that, but so far I've heard they've been pretty helpful.
Absolutely. I think it's really important to notice that all these are very big gestures that the people within Align have done for their doctors. There's been a lot of discussion about, they're a big publicly traded company and, they're not really our allies and friends, but you and I have relationships with the people in Invisalign, and they're really going to bat for the doctors. And I think
Yeah, that's
that's,
what it feels like. I mean, they're trying at the very least. It's, during my interview with both Frank and Simon, it's, they're also a company, right? They have to take care of their team members. They have to take care of their family. So, they do need to make decisions that help their customers, but keeps them afloat too. So it's totally understandable. They can't keep everyone happy.
well, certainly. And if you think about managing and keeping your tier status without doing the volume, it's like they're giving the discount, but they didn't get the sales in return. And that's a really big gesture. And I think it shouldn't be taken for granted.
I thought so too, but you can't make everyone happy. So, and it doesn't mean that there's not other things that they could be small things that they could be doing, and they're listening. So that's why I love that you post that question on your group, because okay, so this is what they're doing. What else can they be doing? So I mean, so far they're all ears. So we'll see what else is coming down the pipeline.
Yeah, I think it's a lot. I think they've got a lot coming.
Yeah.
Talk specifically about Invisalign Hold. What it is it allows our patients to be wearing aligners even if they're done but can't come in right now because of the executive orders and mandates in the individual states. And so, the long and short of it is you can ask Invisalign to send you 3 aligners at their current stage. It's actually 6 aligners, 3 pairs of aligners. Yeah.
Right. Or you can also request for sequential aligners too. That doesn't really apply to me because I can still do curbside deliveries, and it doesn't really apply to me in particular, but I know a lot of people don't have access to their offices or to the patient's cases. So if they want to order that and then reroute it to the patients, then I think that's great too, so that it doesn't stop. Can you tell us a little bit of the wear time, Robin? What do you recommend?
Well, right now I'm definitely delaying my wear time. Typically, my cases I have 7 to 10 days, but because a lot of these states don't have, they don't know when they're going to reopen. So we want to postpone each aligner change as long as we can. And we have a little bit of guidance, and John Morton has certainly talked a lot about the structural capabilities of SmartTrack plastic, and we don't want to extend the wear too long. But I'm telling patients 2 weeks.
Right.
Yeah.
That's great. That's what I'm doing too.
And that's kind of what this slide's all about. Yeah. I wouldn't recommend going beyond 3 weeks. And that's, I've known people who have worn their liners for that long. If you're doing 20 hours a day, they get really gross. And, one thing that constantly in the news is cleanliness right now. And so we don't want patients to be walking around with things that are not clean.
Definitely.
So we're going to talk a little bit about clinical situations here. And
yeah, so we when we were on the phone trying to figure this out for ourselves, we kind of divided things into 3 main categories, right? Like there's going to be patients either starting treatment or in progress or finished. So maybe tell us a little bit about, what the different subcategories of each, and then we're going to discuss them further, in detail later on, but this is kind of like a why we designed this the way we designed it.
Absolutely. Well, certainly starting treatment, if you have people starting and prepaying, that's certainly a blessing right now. I know many of us don't have that, but there were a lot of cases in our office that they'd already paid. They were in ClinCheck. We'd already had them scanned. We were going through ClinChecks, but we did not finally approve it. We have some that we already approved, and the patient can't come in and get their attachments installed. And then we have some where they're accepted, they just need their IPR, and, it's still in the beginning.
Right.
And the second category, which is in progress, meaning that they've already had Invisalign aligners on their teeth for a while. And that's a special circumstance because now you have to find creative ways to manage these cases midway through.
Right.
And lastly, they're done, but they can't come in and get their attachments taken off. And
right. Or scanned or anything. Right.
Yeah, you can't scan them. You can't do bite adjustments. So you got to find creative ways, and we're here to outline some creative ways.
Cool.
I want to talk a little bit about ways that I'm delivering aligners in my office to make transition smoother. And we're messaging our patients basically how they could pick them up. We're mailing some, but we also do what's called a curbside delivery, and this is what it looks like here. We have a little care package, and we give them all of their aligners, even if attachment to IPR are indicated, we still give them to them with written instructions. We just drop them here at the bench, and then we watch them through our little window and watch them pick it up and wave at them. Keep our.
I love it. I love it. That's so cute. And I really love your little gift basket thing. It's like, I'm going to copy a lot of that.
You know, it's been evolving over the years. We keep adding new things, and it's fun. Our patients
love it. Very cute. Oh, and this is my curbside delivery. This particular case is really interesting. This was this patient, Robin. He was one of the cameramen at kickoff when I did the presentation to Align, and then he found my number, and he found me at kickoff. He's like, I'm going to find you, and I'm gonna go to you. I already got your number. And he we did everything, and then he had been dying to get his aligners, and then this whole thing happened. So anyways, he basically was like, I know you guys are only seeing emergencies, but getting my Invisalign is an emergency. So this was actually the very first curbside delivery that we did, and it was really cute. You can hear him at the beginning say, I want to die with beautiful teeth. So
rolling it.
Hey, Frank, how are you?
I want to die with beautiful teeth, so I'm doing it.
No worries. Mr. Forgot. So we have in there some.
That's so good.
Yeah.
Well,
So some of the resources that we have, there's some of the stuff that was basically pilot programs that were thrown into the mainstream just so that we could really manage our patients. Both programs are amazing, and one is a Smile Consult and Virtual Care. Of the two programs, I've had a little bit more experience with the Smile Consult, and I think the best way to describe them both is Smile Consult is synchronous, so basically simultaneous communication is live, right? And Virtual Care is more like they're sending us, their pictures and their information, their aligner numbers, and then you're replying to them. And I don't think they should completely work separately, but they can. I think they're stronger when you're adding each other to the mix. So, you do Virtual Care, they send you the pictures, and then you get to have the Smile Consult too. So.
Yeah, absolutely. The Smile Consult specifically, the patients, it can be a funnel for your practice for like future leads. You there? Oh no, did I lose you? Karla, you there?
I'm here.
Oh, it got a little choppy there. That's all right. We can edit.
Okay. So yeah, I think the beauty of this whole thing is like it's making us jump and evolve right away to something that we probably wouldn't have, right? I mean, I wasn't really doing virtual consults that often, so now I'm doing it all the time. And the cool thing about the Smile, I mean, it's just a Zoom meeting, but it's branded, it looks cool. It tells the patient, there's like some Invisalign pictures, and then it's HIPAA compliant, which is the most important thing. And in this picture, you can see on the left how the patients get their message on email, and then on the right picture, that's how they get it on text message as well.
Yeah, I love it. It's a very clean, branded platform. Certainly is going to enhance your office's brand to use something like this. And yeah, some patients, it's going to drive them to your practice, which the people in Align have continued to reinforce that they weren't necessarily ready to do this, but because of the crisis, they launched it, which means we can use it now, which is awesome. But it's working out some kinks.
Of course, right. And then
Do you want me to roll it?
So that was my first actual consult. I had been doing them for follow-ups and actually emergency patients and stuff, but this was my actual first one for Invisalign, and it was really cool. I actually had this scan, and I was able to walk the patients through their scan. I had never met them, but I had the scans because they had come once already. So it's just very convenient, and you can use it for many things. And the HIPAA compliant thing is the main thing. And you don't have to use it only for Invisalign. I just want to stress that out. You can use it for whatever you want.
Comprehensive care. And you're just doing like what we're doing now. You're just sharing your screen using Zoom, right?
Right, right. I mean, if I have pictures and stuff, sometimes I have emergency calls and I have an old X-ray or an X-ray from a few months, and I'll still use that to explain to the emergency call, you know, what's going on and show them on the X-ray. So I think it's great.
Me too.
And so the funny thing is, so this is not meant to see details of the teeth. It's impossible with the quality of cameras out there. The patients will still try to show you the teeth through the smile consult. So I think for some of these things, it's better to get, you know, some specific pictures. And it's cool because it's a team effort. So in this video, you're going to see my manager as part of the call, and she's explaining to my patients how to use the munchies, which I thought was super cute. So I recorded.
For the bot, recording this because it's too cute.
I love it.
All the way across. And I just kind of do it all the way. And then that way you get every tooth. But, you know, you put the right forces on each one.
Is yours removed already?
Almost. I think I'm on my second to last aligner. So.
Oh, okay.
Yeah.
I think that these kind of team efforts will go such a long way after COVID to just staying connected to people and making them feel important.
Yeah, and it's like you said, it's like, you know, like she's celebrating Susie finishing with her case, and you still, you know, you still talk. I mean, with her, she was showing her view and like her kids, and she introduced me to some of her kids, so you can definitely make it fun. It takes a little bit of time, but, you know, I'm embracing it, so.
Yeah, absolutely. And these take effort, but I think this effort during the COVID crisis is really going to be remembered.
I agree. I agree. And then this is a virtual care, and I'll really quickly, I don't want to go too technical. You and I are going to do a more thorough lecture on all of this later on, but we just wanted to put some of these things out there for our friends. Basically, this is, you know, on your Invisalign doctor site, you go to the virtual care tab, and then you have all of the patients, and then you have, you know, what stage they're on, you have some of the pictures and the last transmission of the pictures that they sent you, and then you can reply. If you go to the next one, Robin.
Yeah.
This is kind of like how the patients, the interface that the patients see, and you can play. I think it's a video.
Yeah.
Yeah. Well, that's my manager like showing me how they're doing it with spoons, because, you know, we didn't even have retractors to give to the patients at this point. I think that's what the intention was. It just came out before it was ready, right? So then they send you all of those pictures. Yeah, I agree. It works to be able to see something. If you go to the next slide, then after that, you get to see all of those pictures and you get to play the little video. So, you know, and then you get to reply, you're on track, let's schedule a small consult appointment, or you can send specific instructions if you want them to use them for longer, if you want them to munchie more on one side, or whatever you want to say. So I think it can save time, not only now, but for the future too, how to manage future Invisalign cases.
Yeah, and you can do this stuff, you know, when your kids are sleeping. It doesn't have to be time business hours.
Important one for us.
Totally. And I'm going to talk a little bit in detail about clinical situations and ways to maximize the clin checks so that the teeth are moving, even if you can't put on attachments and do IPR and have regular visits. Just to kind of outline the purpose of this, I think that our inability to treat patients in office makes us get really creative. And we want to make sure we're continuing to provide patients continuity of care, because the worst case scenario, these patients, you know, something happens, they lose their job, and they're calling us saying like, I can't do this case. I haven't received an aligner. I want my money back. So you want to be able to deliver something.
It's giving me a heart attack, Robin.
Seriously. We've had one
yeah.
patient. Yeah, it's a tough scenario to deal with. It's real. B, we want to be able to help so that when we do open, our office is doing fillings and crowns and starting new cases, and we don't want to have a whole day of aligner checks the day we open, the first day. We want to be able to be productive in this downtime. And we want to work towards our end goal of getting the teeth straight, the original clin check, and we don't want to compromise too much, although we are possibly, with these creative solutions, going to be extending the length a little bit. Cases are going to take a little bit longer, but that's okay. At least they're moving towards the end goal.
Right. And I think not only everything that you mentioned, but like the worst idea in my head is like to go back and we are able to finally see patients and they're all like stop wearing aligners and they all stop like doing things. And now you're like additional aligners like full on start from scratch. And that's what I'm really hoping not to have to deal with.
Absolutely. It's interesting because I think we're going to have some patients that have used this time to like embed self-embetterment and like get fit. And there are other patients that are like, I didn't wear my aligners at all. Like
For sure.
I've been on the couch watching Netflix and
Snacking all day.
snacking all day. Yeah. So we talked a little bit about the different scenarios. If the patient's already accepted a ClinCheck, the aligners are manufactured. Even if there's IPR or attachments, we can deliver an aligner. They can try their first aligner. We can give instructions using the consult platform. We can mail to our patients. And we can order a separate attachment template when let's say we do 8 weeks later. Even though there's attachments on the aligners, you can't deliver the actual attachments. You can start to move teeth even with the attachments there and then just get a template when they come back.
Right.
If they need IPR, there's a couple of options. And one, you can basically redo the ClinCheck and have it staged at a later date. So you stage the aligners, you do expansion first, and then you stage the IPR for a later time. But sometimes you have to wait. And this is the worst case scenario, but sometimes you have to tell your patient, look, I can't see you until this is over. And this is a special category, but that would be unfortunate.
I think that's the hardest one of them all. Like, it's almost like most of them are manageable with the exception of the IPR situation.
Right. And, I've heard some creative out of the box solutions, including mailing quick strips to patients and giving them smile consult instructions. Look, I have no judgment. I don't. And I think that that's not unreasonable to do. And I think if you're watching them and supervising them and you're really hands-on about it, good for you. No judgment from me. If you're starting, ClinCheck is not yet accepted, this is where you have the opportunity to really get creative. And I want to go into some of those scenarios. I've had a handful of these cases. Another thing in town in Austin, Texas, there is Image Dent, which will still scan patients and take photos. So, hypothetically, you get a patient started, you can send them to Image Dent and they're considered essential, but that's their scenario. Let's go into a little bit of detail with this. The big hard one that a lot of my patients are going to be really hard to start are deep bite cases where you're doing a lot of anterior intrusion because you need the anchorage from the attachments. And a lot of these cases, have complex movements. We call them, tier 2 or tier 3 movements. But what you can do is you can type in the ClinCheck to the tech and you can say stage 1, only tip the crowns and relative intrusion, which you're not actually pushing the teeth inward or into the bone. You're actually just tipping them out, which causes relative intrusion. And you can put bite ramps on to help. But then you can tell them in stage 2, which you can say like, do this stage 2 starts at aligner 10. They put the attachments on and then they focus all the effort and force on the actual intrusion.
Cool. And Robin, this is a question that a patient of mine that I just delivered aligners with this whole thing in mind. She asked me like, how much longer do you think my treatment is going to be now with this staging? I didn't know what to answer. What do you think?
You're just throwing a number out there, really. I would say it's going to increase 20, 30%. It depends on how long this, lasts in your state until you can actually put the attachments on. But yeah, if let's say you're opening in June and they were, in 2 months, you did 2 months of stage 1, you're essentially lengthening the case by 2 months.
Right.
Well, you're probably actually only lengthening it by a month.
Yeah, maybe. Okay, cool.
For cases with a lot of root tipping or torquing, these are difficult movements which require, smart attachments and power ridges and things like that. First thing you want to do is look at your ClinCheck and determine whether or not you need those movements. If there's a way to do it where you can do a refinement later to capture some of these, you can do it that way and eliminate the non-essential. I like that term, non-essential. We've been using that a lot.
I like it depending on how it's used.
Yes, no, I don't like it talking about chemistry. But
I've learned to hate it too.
But you can stage it to where you're doing crown tipping only for part of it, and you just type this into your text. You say stage 1, crown tipping only on tooth number 6 if you're trying to do a root tip of a canine, which is hard movement, very difficult movement. And then you have stage 2 where they put the attachment on and they focus only on the root tipping. And there's ways you can set up the crown to be in a best situation. You tip the crown a little bit the other direction, so when you do the root, it counter. You get, what do they call these things? I'm losing the term, but the forces work together, and that's what you want to do. And I can go into that on a ClinCheck slide when we do this with the line.
Yeah.
You can do that in the staging when typing on ClinCheck Web. And the last scenario is the IPR and attachments, and it's pretty simple. You want to tell the techs for the first 8 aligners, no attachments and no IPR. And then they can start the staging after that. And you'll limit the movements for the first 8 aligners to mostly being crown tipping or expansion movements, some rotations less than 20 degrees, and then you deliver them through the curbside or mailing.
I want to add something because I've been doing that since, you and I spoke, and I've been changing the protocol. Make sure that when you do write that down for the tech, make sure you say it, that those instructions are specific for the first 8 aligners. Because then I got some ClinCheck back, like 2, I think. I got 2 back, and they're like limited the whole ClinCheck to those instructions. I'm like, no, guys, just for the 8. So just make sure you say that in the instructions.
That's a great point. And there's going to be times that, there's a lot of different texts. You have to say things differently a few times to get the point across. So you have to really check your ClinChecks to make sure that they follow those instructions. You going to take this one?
I mean, this is almost like the easiest one in terms of like the in progress. They're going to either be on hold or they're going to be, they're going to keep progressing. Ideally, they keep progressing the normal way. So basically, if we had a patient that had an appointment for regular follow-up, then, we either, like Robin said, curbside pickup, or we request the remaining aligners from a line and reroute if you don't have access to your practice, or, like those are like the 2 main actions. You can then, like I said before, you can use mal consults to follow up with them and the virtual care just to make sure that you can see those pictures in a little bit more detail. Now, if they're in progress and they need attachments of IPR, this is where the Invisalign Hold program, I think it's what it was designed for. Ideally, you don't want to stop. You want to continue even if it's at a slower pace. But when we need IPR, I personally think that I need to keep the patient on hold. I'll also look at the ClinCheck and see exactly where the IPR was and what kind of movement was happening, and see if I could get away with, still delivering some more aligners. But I think that's really, when Robin and I spoke, the option of just holding and delaying the IPR until, that we're open is the best thing to do.
I think so too. Yeah. And again, there's a lot of creative options here. And if you guys have any you want to share online, then share them, and no judgment. This
would be great. Absolutely.
Then the last stages cases are finishing. You can either order them some hold aligners, some extra ones, or you can order retainers from their last stage. And then you could virtually consult virtual care to kind of give instructions and follow through with them and let them know you're going to be reaching out after the crisis is over.
Right.
Let's go to our full faces here. Holla.
We did it.
We did it. Yeah, I just want to say thanks, guys. And these are really weird times, and they're very hard on all these practices, all of our practices. And the great thing about Align is that we're not alone in that. And we have a way that we can deliver care. It's more efficient and effective than the way we can deliver fillings care and, hygiene.
It's almost made for this, right? It's almost made to be tested during these times. And not only having the resources from the companies too, but I think, what you and I are doing, or what you and I have been doing as friends, sharing flows or sharing ideas. What are you doing with this? I think that's the most important thing we can do right now with each other, which is why we made this video.
I know. Thanks, guys. We're here to help. Ask questions, share. Thank you.
Bye.